Time now is 7:18. Eating disorders are often a taboo topic, but impact many people across the U.S. Doctors say 30 million men and women suffer from a clinically significant eating disorder at some point in their life. Dr. Meredith Maxwell joins us now with what defines an eating disorder and how to get help. And this is all coming ahead of next week, which is National Eating Disorder Awareness Week. So a lot of times, it's hard to approach somebody, or, it's hard for people that have these disorders to talk about it. So first off, though, what is an eating disorder and what are the different types that are out there?
So it's an illness that seriously affects your diet by either eating too little or too much. There are about 3 types. There's the anorexia nervosa, the bulimia nervosa, and the binge eating disorder, which is a little bit more rare and less known about. So those are the 3 types.
Anorexia, because they're all different and have different symptoms. And how can you tell anorexia apart from bulimia?
So anorexia is little intake of food, lots of exercising, very, very thin weight, relentless pursuit of just trying to maintain that little weight. So theirs is kind of a restrictive type of control. And the bulimia is more of the binging and purging. So they'll have a binging episode where they eat a whole lot, and then they'll compensate by either using laxatives or by purging or vomiting. So that's their control mechanism, and they're usually normal to overweight. So, and then the third one is the binge eating disorder, where they just eat large amounts of food and feel guilty, and that kind of propensates the next step of binge eating. And there's really no mechanism that they binge or purge or restrict, but these people are very obese, overweight, at risk for heart attacks, heart disease.
And what is the reason why? What is the biggest cause of having an eating disorder?
So they think that it's genetics, it's learned, it's your environment. There's usually comorbid associative disease processes going on, like depression, anxiety, obsessive compulsive disorder. There's no one reason, and scientists are still figuring out exactly what causes that. And there's probably something underlying with every single person that has one of these disorders, unfortunately.
So what can you do as a friend of someone where you recognize this and you know that something may be going on? Because if you approach somebody, it's the way you approach them and how you go about it that I think makes a big difference.
Definitely. I think you should have a relationship with this person beforehand. They're very secretive, and they can get very defensive really easily. So maybe establish a relationship, get their family members involved, figure out why the underlying disease process is going on, and that can be kind of difficult, that they might not know themselves. Involving therapists, medications can help, nutritionists can get involved. Sometimes, you relapse and go into it and out of it. It's a mechanism of control, so when everything else is out of control in your life, that's the one thing that they do feel like they can control. So it's a really hard thing to break.
And I can imagine that if it gets to a point where it's really serious, it could be life-threatening in some cases.
You can have severe electrolyte abnormalities that you might need to put people in the hospital for. You can have heart arrhythmias. It's very sad because you just see these people slowly declining, and sometimes you can't help them. So just making them aware about the process, not getting them on the defense is really important.
That's
and then
key.
Family involvement, yes.
All right, definitely some important tips this morning ahead of National Eating Disorder Awareness Week. Thanks so much, Dr. Meredith Maxwell, for joining us.